Hello friends, welcome back to my YouTube channel. So in today's video, we are going to see an important topic on toxicology, that is agricultural poison. The important subheading of agricultural poison, that is an important essay question for all of us, is organophosphorus compounds or OCP poisoning. So it is going to be discussed under 7 topics, that is definition, mechanism of action, clinical manifestation, treatment, complication, autopsy, and medico-legal aspects. So first let us see about definition. Organophosphorus compounds are commonly used as pesticides by farmers or agricultural users. So these organophosphorus compounds are commonly the most common suicidal poison in India. So it is used as self-poison by farmers or agricultural workers. It is not commonly used as homicidal poisoning because it has characteristic smell, kerosene smell, so it cannot be used as homicidal poisoning. It is commonly used as self-suicidal poisoning. So next let us see about mechanism of action. So the mechanism of action, this is a presynaptic neuron and this is postsynaptic neuron. This is synaptic cleft. So what happens is that the colon is being formed in the presynaptic neuron. It comes to the synaptic cleft, and in the synaptic cleft it binds to acetylcholine with the help of acetylcholine esterase, and then it binds to the acetylcholine receptors present in the postsynaptic cleft. This is a normal pathway. Here, this acetylcholine, since acetylcholine esterase is not present, it will be inhibited. So this acetylcholine will not be breaking down into acetic acid and choline, and this acetylcholine receptor will be combining to OCP molecule. So here the waste products are not formed. This leads to accumulation of acetylcholine. This thing will be accumulated. Since it will not be breaking down into waste products, this will start accumulating. So accumulation of acetylcholine, it leads to two things, that is overstimulation of muscarinic receptors and overstimulation of nicotinic receptors. So this is what is the mechanism of action. So next let us see about clinical manifestation. We already said that accumulation of acetylcholine leads to overstimulation of muscarinic receptors and nicotinic receptors. So clinical manifestation is also going to be regarding that only. That is, first let us see the muscarinic receptors overstimulation effects, or that is parasympathetic effects. So let us see system wise, that is GIT, CVS, RS, ocular and glands. So generally when muscarinic receptors are overstimulated, it leads to excess salivation, cramps, abdominal disturbances or GIT disturbances or vomiting. And then in CVS it is hypotension and bradycardia, RS bronchospasm and cough, wheezing. Ocular manifestation is blurred vision, miosis, that is contraction of pupil. And then in glands there is one important condition. This is very important, that is chromodactyria, that is red tears present due to accumulation of porphyrin. The patient will typically shedding red color tears, that is like it look like bloody tears, that is due to the accumulation of porphyria in the lacrimal gland. So you can remember this with a mnemonic, that is sludge. S for salivation, L for lacrimation, U for urination, D for diarrhea, G for gastric disturbances, and E for emesis. Organophosphorus compound is usually mixed with solvent or aromax that is only responsible for kerosene-like smell in breath. So this organophosphorus poisoning, the patient typically presents with kerosene-like smell in breath. So this is why it is present. So next let us see about nicotinic receptors, that is overstimulation of nicotinic receptors. So it leads to muscle cramps, weakness, respiratory failure, paralysis of respiratory muscles. So in fact this respiratory failure is a cause of death in patients with organophosphorus compound poisoning. So next let us see about CNS effects. So the patient will be presenting with restlessness, headache, tremor, drowsiness, confusion, etc. So to make it more interesting, I have drawn a person representing OCP man. So this man presents with all the clinical manifestation that we have studied so far. Let's see from head. That is the patient presents with coma, convolution, headache, that is CNS effects, and also tremor. All these are CNS effects. Next, let us see about the muscarinic effects, that is excess secretions, that is salivation, lacrimation, sweating, blurred vision, contracted pupil, all that. Next, let us see about the respiratory system effects, that is cough, wheezing, bronchiorrhea, dyspnea. And then abdominal issues, that is cramps and vomiting, then diarrhea, urination, tremors, muscle twinges and weakness. So this is the typical presentation of OCP man. Next, let us see about the common cause of death in OCP poisoning, that is respiratory failure, bronchoconstriction and increased bronchial. Next is fatal dose. So we already know that OPC, organophosphorus compounds, which includes several compounds. Of that, parathion is the highly toxic compound, that is just 0.0 gram per 70 kg is fatal. That means it leads to death of the patient. And the malathion is a very less toxic compound. 60 gram per 70 kg is fatal. And next let us see about the fatal period, that is 24 hours if not treated, and within 10 days if treated and non-successful. Next let us see about the treatment protocol. So if a patient is suspected with OCP poisoning, you should check for airway, breathing, circulation and intubate the patient if needed, and then decontamination. After that, based on mild exposure, moderate exposure and severe exposure, the treatment protocol differs. In mild exposure, observe if the patient has symptoms, atropine is given, and then make the patient asymptomatic and discharge after 6 hours. Or if the patient is already asymptomatic, you can discharge after 6 hours. Then comes moderate exposure. In moderate exposure, we give two things, that is atropine and oxime. And in severe exposure, we give three things, that is atropine, oxime and diazepam. So in this, we basically if there is no complication and symptoms, extubate the patient and then discharge. So we told we are going to give three things, that is atropine, oximes and diazepam. So atropine is basically given to block muscarinic manifestation, oxime is given to overcome nicotinic effects, and diazepam is usually given to treat CNS symptoms. Next, let us see about the complications. So the complications are divided into two types, that is immediate and delayed. In immediate complication, it is pulmonary edema, aspiration pneumonia, peritonitis and coagulation abnormalities. In delayed, it is paralysis, neurotoxicity and Guillain-Barré syndrome. Next, let us see the postmortem findings. So postmortem findings is also divided into two, that is external and internal findings. In external findings, the patient presents with kerosene-like smell from the nose and nostrils, then cyanosis of lips and fingers, deep postmortem staining, congested face, blood-stained frothy discharge. And in internal findings, it is mucosa of stomach, respiratory passage, lungs, all three are congested. Stomach contents smell like kerosene and edema of brain. So next let us see the final part, that is medico-legal aspects. In medico-legal aspects, hospitalization of all symptomatic patients for almost 4 to 6 days after resolution of symptoms, that is even after symptoms are gone, the patient has to be hospitalized for more 4 to 6 days to rule out any respiratory depression that occurs most commonly within a week or
2 weeks after resolving all the acute crisis. Next one is accidental poisoning or occasional poisoning is seen in children because we said that OPC is pesticide, and all vegetables and fruit that we consume contains minimal amount of OPCs, but those minimal amount does not lead to death. It can have small health issues, but it will not lead to death. And then it is commonly used as suicidal poisoning, and it is not likely to be used as homicidal poisoning. A big no, because it has characteristic kerosene smell, so it cannot be used as homicidal poisoning. So with this, I end today's video. Thank you so much, friends, for watching. If you found this helpful, do subscribe to the channel for more such videos. Also share it to your friends.